Hi, Amanda here from Azon Medical, and today I'm going to be showing you how to fit the Game Changer unloading knee brace. So I have Quinn here with me today. She's going to be my patient. Thank you for helping me, Quinn.
Of course.
Awesome. So these are universally sized, these knee braces, and what I'm going to be showing you is how to fit them to a patient and size it for them. So these do come in either a left or right, so you can tell this is a left-sided brace. It does have an L on it. And what we're going to do once we fit it to our patient is we're going to use the key that comes with it to unload the joint by shifting the pressure from one compartment to the other. So these braces can actually unload either compartment just depending on how you make that adjustment. So I'm going to put it back in neutral to go ahead and get this fitted to her. All right, so the first thing you want to do is you want to release these buckles here that say push, okay? So we don't want to unthread these clips. We just want to release them like this, okay? So I mentioned that these are universally sized. So we can adjust the length of these straps to fit most any size patient, and then the actual frame of the brace will form to whatever size leg the patient has. So as you can see here, we can adjust the length of the strap with this tab, right? So we can make the strap a lot longer, or we can make it a lot shorter. But to make a significant sizing adjustment, we actually have to go underneath. All right, so you can see we've got some padding here. This is going to be for added comfort, but for the sake of this fitting, we're actually going to take these off so that I can access more strap underneath. So I'm just going to set these aside, and I can add these back in when I'm doing the fitting if I feel like they're going to benefit that patient. All right. So under here you can see, underneath that padding, we now have more strap. So this is where I can make this strap significantly longer, right? So if I adjust it from both ends, you can see just how long this strap can go. Or I can pull it back in to make it much smaller for a much smaller patient. Now, if you have a really small patient and you're finding there's just way too much strap here, you actually have the option to remove this little Velcro square, and you can cut the strap, and then you can replace the Velcro square, and now you have a shorter strap. I wouldn't be super quick to cut that, but with some patients you definitely will need to, and so you do have the option. All right, so when you're gonna fit your patient, you wanna have them seated with both feet flat on the ground, and you wanna have them kind of scoot forward, right? So go ahead and scoot towards the edge of your chair for me. This way I've got the full leg here so I can fit the brace on there. All right, and you want to make sure their ankle is lined up underneath their knee, right? So we have a nice clean angle here. So I'm going to go ahead then and I'm going to place the hinge in the right spot on her leg, and then I'm going to start adjusting the length of the straps. Now the hinge placement is super important. If the hinge is too high or too low or it's not in the right spot, we're not going to have that pressure going through the joint, and we're not going to be able to actually unload it. So I'm going to show you how to get the perfect placement for your hinge. All right, so what I'm going to do is I'm actually going to locate the patient's fibular head, all right, and then I'm going to place the hinge right above that. That's where you want your hinge to sit. So once I've located that spot, I'm going to line the hinge up, and then I'm going to adjust the brace into the same angle as the patient's leg. Now, I'm going to ask my patient, if you would go ahead and help me with both hands, hold the top of this brace nice and secure for me, hold that down for me there. Then that way I have both hands free to start adjusting the straps. Okay, now keep an eye on that hinge. As you're pulling on the straps, if your patient's not holding that secure enough, the hinge is going to start moving, and then by the time you've gotten all the straps tightened, it's no longer in the right spot. So just keep an eye on that and make sure it's not moving around as you're adjusting these. So these straps are numbered. So the second from the bottom, the numbers are right here on the clip. This is number 1. So I'm going to start there. And I'm just going to tighten this up. So we do need this to be tight enough that it's not going to slide down the patient's leg. Now, of course, we don't want it to be uncomfortably tight, but we do need to make sure it is going to stay in place. So I'm just going to start with these straps, get them nice and tight. Now, let's say you're working with the strap and you find that you don't have enough strap, right? It's not long enough, you need to make a significant sizing adjustment, or maybe it's too long, you need to make it a lot shorter. Instead of taking the brace off to access the bottom, what you can do is just flip it around. And now we have easy access to adjust the length of the strap this way to make it significantly longer or shorter. And then just flip it back around. All right, so I'm going to go ahead and buckle in here. Thank you very much. I got this part now. So this might take a few minutes. You can definitely let your patient know they're not going to have to make these sizing adjustments themselves at home. So they might look at all these straps and go like, wow, this looks very complicated. Assure your patient, once you adjust it to their perfect size, they're not going to have to make any of these adjustments. They're just simply going to be buckling and unbuckling, and they might make some minor, loosening and tightening with this tab here, but they definitely will not have to go underneath and make those sizing adjustments. All right, so once I've got these nice and secure, then what I'm going to do is I'm going to have my patient stand up. All right, so the first thing I want to do is confirm that the hinge is in the right spot. All right, so I want to make sure that this is going to be right on the side of their joint. I feel like I've got really good proper placement here. Okay, then I also want to make sure these straps are tight enough. If you can fit 2 fingers into there, it's not quite tight enough. So I am going to tighten these up a little bit. Okay, that way we want to make sure it's not going to slide down her leg. All right, so now we're going to go in and we're going to make that hinge adjustment. You do want to make this adjustment in a weight-bearing position. Okay, so I'm going to take my key and I'm going to insert it right here. You can see above the hinge, and we've got arrows that say in and out. All right, if we turn it in, what that's going to do is it's going to open up the medial compartment. Okay, if we turn it towards out, it's going to open up the lateral compartment. So based on the patient's x-rays, that's how, of course, you're going to determine which compartment you'd like to open up, and you're just going to turn it in that direction. So I've inserted my key, right? Now, keep in mind here, you're not going to feel any resistance when it's in neutral. So you can turn it a little bit here, and we're not actually unloading anything. That's neutral. It's when you start to hit resistance is when you start actually unloading the joint, and you'll start to see the hinge moving, okay? So it's pulling the hinge away from the side of the joint because I turned it clockwise towards out, and if I turn it counterclockwise towards in, you'll see the hinge is pushing inwards to relieve the pressure on that medial side. All right? So you can go ahead and sit down for me. So I get this question, of course, all the time, how far to make that adjustment? So every patient is going to be different. They're going to have different stages of degeneration, different levels of severity. So there's no, like one size fits all as far as how far to make that adjustment. And it's totally up to the prescriber, but I do want to give you some advice on how to ease the patient into this so that you are actually unloading a joint without causing any unnecessary discomfort. So what I generally recommend is adjusting it a quarter turn past neutral, right? So when you're hitting resistance, that's where your turn is starting. A quarter turn on the first visit is usually a good place to start. So you may not fully unload a joint with just that quarter turn, but if we go too far too fast, we may cause the patient some soreness and some discomfort, and that we'd like to avoid. Right? So it may take a couple of visits to fully unload a joint with this brace. So let the patient know that. Give them the accurate expectations. Over the next couple of visits, we're going to be easing you into this. And then the end goal is that we're going to be relieving the pressure in that compartment and creating actually a little bit of a physical space there, which is going to result in significant pain relief. So how do you know when you've unloaded a joint? Well, you can take x-rays. You certainly don't have to, but some people like to do that just to see. But your best bet really is going to be to base it off the patient's feedback on how the brace feels and how their joint feels. So when you make an adjustment, let's say a quarter turn, the patient may experience immediate relief, but it's definitely not required. Really, we want to give it 24 to 48 hours and then see after that, how does it feel? If they are experiencing significant pain relief at that point, that's great. We don't have to keep messing with it. That's perfect. That's what we're looking for. If they're like, wow, this feels amazing. I feel like I can walk way longer. I can be on my feet way longer. Excellent. That's exactly what we're looking for. If they're going, well, I don't know if I really feel a difference, I'm not sure if I can tell anything's happening, then all right, we need to go a bit further. So then they'll come back in, whether it's their next visit or you're going to have them come back in specifically for this and do another quarter turn. And continue like that. Give it another 24 to 48 hours, let them get used to that, and then again, get their feedback on how it feels. It may take a couple of adjustments to get to that point, but if the brace has been fitted properly, you will get there. One thing to note is if you do keep adjusting it and you're just not getting any relief, chances are the hinge is not in the right spot. Now maybe you're putting it in the right spot, but keep in mind they're putting it back on themselves at home. They may not be putting it in the right spot. So you do need to check for that as well. If you're not getting that relief, make sure they're putting the brace on correctly when they are at home. So if the patient experiences new discomfort or soreness in a spot that maybe they were not experiencing any soreness or discomfort before, that's a sign you may have adjusted it too far too fast. So if that's the case, then just go ahead and back it off and then continue to gradually build from there. A really good gauge is going to help you kind of determine how much that patient's going to be able to tolerate at a time is going to be their x-rays. So if you have a patient who has very severe degeneration, right, so maybe they're very knock-kneed or very bow-legged, keep in mind that the brace itself is straight. So just putting the brace on, even in neutral, is actually going to be making some changes, especially for those very severe patients. So there are some patients in that case, you may want to start them in neutral for 24 to 48 hours before you even go in and make any adjustment. So hopefully that gives you kind of a good idea on how to do that. The idea is that we want to unload the joint, but we don't want to cause the patient any discomfort. So kind of going gradually over time is usually the best way to achieve that. All right, so next I want to show you this accessory that actually comes with this brace. So this is a suspension sleeve wrap. So this is a stretchy wrap that you can use to secure a brace that is sliding or slipping around. So you will find with some patients that the brace just slides down their leg throughout the day. No matter what you do, no matter how tight you get those straps, it just slides. So this will prevent that and it will resolve any issues of that kind. Also with some patients, they have like sensitive skin, and so you don't want to make those straps too tight. You're concerned about them digging in. What you can do is you don't have to make them quite as tight, and instead use this to secure the brace. So the way this works is we've got a strip of Velcro here, so that will just attach onto the brace there, and then it wraps around, and then the patient can stick their fingers through these right here to get that compression and secure it. So this can be used over or under the brace. You can use it around the bottom, the top, the center, or any combination of those three. So this brace does come with one, but a lot of insurance carriers will pay for these along with the brace. So if the brace is covered, they'll also cover the sleeve. And a lot of insurance companies will pay for more than one. So if you need to order additional ones to go with the brace, you can. You can do one at the bottom and at the top. It's just whatever combination you're going to need for the brace to be comfortable and wearable for that patient. So I'm going to go ahead and remove this. So once you're done fitting your patient, what I recommend doing as well is a simple brace test with that patient. So you need to make sure before they leave that they know how to take the brace off and put it back on correctly. So to take it off, you're just simply going to press these release buckles here. So go ahead and press those. Okay, super simple, don't unthread anything. Just go ahead and release those. All right, and then what you're gonna wanna do is you're gonna wanna really show your patient how to put it back on themselves. Make sure they understand this. So the most important part is going to be that hinge going in the right spot. So what I've seen people do that is really successful is they'll kind of do a little demonstration with their patient and they'll go, okay, so this hinge needs to sit on the side of your joint, okay? So you're going to be fitting yourself seated. So go ahead and if you would, point to the side of your leg where you think that hinge should go. Okay, good. Now she knows, she's educated, but a lot of patients are going to point here, right? Or down here, and they point to the wrong spot. So then what you can do is say, all right, so let's go ahead and straighten out your leg. Keep your finger there. Let's go ahead and straighten out your leg. Let's go ahead and extend that if you would. All right, so we can see that's actually not the side of your joint. We want the hinge to go here. All right, so go ahead and bend your leg. That's where you need to place that hinge when you're seated. So just take a couple of minutes, really make sure they understand that, even if you have to go through that with them a few times, and then give them the brace and watch them put it back on themselves to make sure that they are going to do it properly at home. This may take 10 minutes or so, but it really makes a huge difference in patient compliance and whether they're going to get the best possible results. Cool. Well, thank you all so much. Thank you so much for helping me today. If you have any questions about fitting these braces, definitely reach out to us here at Azon. We're here to assist you with your entire bracing program.